Hi everyone, I'm Rick Cox, and this is another clinically pressed leadership insight. Today, I want to go over and review an article written by Dr. Matt Kutz called "The Significance of Leadership for Advancing Clinical Practice and Improving Patient Outcomes in Athletic Training." This is from the October to December 2020 edition of the Athletic Training Education Journal. And I really wanted to kind of go over this one because I think it made an excellent case for why we should be really choosing to make leadership development a priority as athletic trainers. And it starts off, it talks about how leadership in healthcare in general is so important because we're moving away from a disease oriented care to patient oriented care, where we look at the patient as a whole and not just as their disease, which I think all of us have we all know how important that is in dealing with the patients that we see every day. We want to look at them as people and not as a diagnosis. And this article continues to go over why that should continue to happen. So it talks about how intentional leadership being practiced by all healthcare providers is leading to improved outcomes. And because of that, ATs need leaders with people-oriented expertise. And I think that's one thing where we are incredibly unique is, oftentimes we see our patients or our athletes every single day. So we get to know them. We get to know them as people. We don't just see them and think, oh, that's the shoulder, that's the knee. And we really are able to develop these amazing relationships with our patients, with our student athletes. So continuing to develop those skills of leadership is incredibly important. And all athletic trainers all the time should strive to really practice leadership and really make it a priority. It's not just meant for those in research or in academia. As Matt says, it's actually meant for every clinician in every single setting, because we're on the front lines. We're treating our student athletes. We're treating our patients daily, and it's really important that in order to get the best outcomes, we need to be developing these leadership abilities. So again, the patient-oriented paradigm assumes the patient identity is more than the disease, which is incredibly important. And it's also important to differentiate between the leader and a leader. One person in an organization can be the leader. Anyone can be a leader, and this is something that I have actually said on multiple occasions, something that I've said on Twitter. I don't look at leadership as a position. It's a mindset, and anybody at any level of any organization can be a leader if they choose to be. I talked about this pretty extensively in one of the other episodes of Leadership Insights when I talked about leaders versus managers. And when it comes to leadership, it can't really be a switch that we turn on and off, right? We need to be constantly honing in these skills. We need to really constantly be developing these skills, and we need to be practicing it all the time. It's not something that we really should be, when I'm at work, the switch is on, I'm practicing leadership, and then when I go home, I'm not. Because, it's something that's so important that we need to kind of really, in all aspects of our lives, we need to be developing those skills and abilities. And it's the responsibility of every athletic trainer, regardless of the role. You don't have to be a director of sports medicine at a Power 5 conference to be a leader. You don't even need to be a head athletic trainer. You can be, whether you're a single athletic trainer at the secondary school setting, or you are an assistant athletic trainer at a college, wherever it is. You need to choose to be a leader in that position. And the practice of leadership allows athletic trainers to connect with their patients beyond their disease. We've talked about this before, developing relationships with your student athletes, with your patients, is incredibly important. And I want to read a quote here from the article. If the practice of leadership, apart from and outside of formal job duties, is not expected of every AT, regardless of position or experience, hope for athletic training to be a viable and contributing healthcare profession is at risk. Um, I think that's so important, and and I'll get as we get further on, I'll talk about that a little bit more. And we need to be transformative leaders, right? We need to tactfully call into question the status quo and actively advocate for new practice models, and at the clinical level, foster change in those around us. Right? We can't be set in our old ways. We need to be constantly pushing the envelope. We need to be constantly learning. We should be students forever, and constantly developing. And I think leadership is one of those things where you can look at it and say, you're never going to be good enough. Excuse me, you're never going to be good enough as a leader. You can always get better. Um, and then purposefully developing clinical leaders fosters desirable changes in healthcare. That's what we talked about, right? Like becoming a higher quality leader leads to better patient outcomes, which is obviously the goal. We always want great outcomes with our patients. We want them to trust us. We want them to know that they're gonna get great care when they come to us as athletic trainers. Um, he talks about developing soft skills in addition to being a good clinician. So hard skills are those skills that are needed for us to do our job. Right? We need to learn how to evaluate. We need to learn how to special tests, rehab ability, things like that. And then he talks about the soft skills. What I really like is Simon Sinek often refers to them as human skills, and they are skills that make us a better human being. These are things like leadership, like empathy, like the ability to build relationships. These are things that we as clinicians need to develop, and it needs to really start with athletic training students. Athletic training education programs need to, I believe, truly push leadership development early and make it a habit in our athletic training students, so that way when they become certified and they become clinicians and they're out there in the world on their own, they've already formed that habit of developing leadership, and they're only going to continue. And one thing that he puts in here that I really liked was, because developing leadership skills is important for a profession to grow, it also stands to reason that if individuals in a profession choose not to practice leadership, then the profession will suffer. And I totally agree. If we need leadership to grow, and we don't choose to make it a priority, how are we going to make it grow? And that was just kind of one of the big takeaways for me. And then to finish this up here, what I want to finish up with is, everyone should make leadership a priority, because it will provide better outcomes for our patients. Anyone, no matter how stretched thin you are, if you're alone in the high school setting, it can be you might have a lot on your plate. I totally get that. But if you make it a priority, you can find the time in it. It could be as little as 10 minutes a day, reading a book, listening to a podcast, reading an article, whatever it is, networking with, talking to people who you consider to be great leaders. These are things that you can make habitual, and whether it's 10 minutes a day, half hour a day, or whether it's a big part of your week, it's only going to make you better as an athletic trainer. And we owe it to the people that we treat to be at the top of our game as clinicians, and developing leadership skills will help us to better serve the people that we treat and that we see every single day. And really, I think what we all want athletic training to be seen as a top tier healthcare profession. And this is one element that is absolutely vital to accomplishing that. We all talk about how sometimes we are not we're not respected by others in the healthcare space, and sometimes we can get in our own way. And I think if we choose to look at it and say, hey, we need if we choose to develop our leadership ability, and we were able to show that our outcomes are better because we are leaders in healthcare, everyone's going to have no choice but to kind of look up and say, hey, athletic training is more than I thought it was. And hopefully, even not just from our healthcare peers, but from everywhere, from coaching to our parents that we deal with, if they know more about what we do and how we're able to treat their student, their athletes, their sons and daughters, it's only going to grow. And if we can step up and be leaders in the healthcare space, and we can show other providers that we have excellent patient outcomes because we have developed leadership skills, those that look down on athletic training will have no choice but to reevaluate how they look at the profession. And that is something that I think, I see all the time on social media. People complain, we're not, so-and-so doesn't respect us as healthcare providers, and sometimes they don't even know that athletic training is healthcare, and that this is a way that we can really change everyone's mindset on what athletic trainers are and what we do. And lastly, really what I hope everyone listening to this realizes is how important this is, and really chooses to develop their leadership skills and abilities so that we can all grow together as a profession and show everyone that athletic trainers are some of the best healthcare providers in the world. We know we are. Athletic trainers, we know what we do. We know that we are amazing individuals who provide excellent care to the people that we see, and really we want others to see it as well. So I hope that everyone knows that this is a key component, and we need to really make it a priority. So thank you guys for listening to this edition of Leadership Insights. I hope you enjoyed it, and I look forward to hearing from you, and I hope you keep developing that leadership ability.